morning, everyone. And I echo what Bailey said earlier. It's so nice to see so many people from across the globe that have joined us today. So, again, thank you for joining us for February's edition of Health Bites with Region 3. We are so pleased to welcome this month's speakers, Dr. Emily Vardell and Dr. Julie Schiavo. Dr. Vardell is an associate professor at Emporia State University's School of Library and Information Management. She teaches library science and health sciences librarianship with a focus on health literacy and improving access to health information. Her recent publications address health insurance literacy, infertility information practices, and library science education best practices and trends. Emily is co-editor of Health Literacy in Libraries and is active in the Medical Library Association, serving in various leadership roles. She has received multiple professional awards and is a former Fulbright Scholar in Vienna, Austria. Dr. Schiavo is an associate librarian and assistant director, dental services at Louisiana State University Health Sciences Center, New Orleans. Julie holds a Doctor of Education in Higher Education Administration and a Master of Library Information Sciences from the University of Southern Mississippi. She is a distinguished member of the Academy of Health Informational Professionals. Her research interests and recent publications include health literacy, health sciences, faculty peer review and publishing practices, and equity in higher education. In today's Health Bites, our speakers will give a presentation on measurements of health literacy. Thank you so much for both of you for being our guest speakers this morning. And now I'm going to turn everything over to you.
Wonderful. Thank you so much for that introduction. So
Thank
we're
you.
excited to be talking with you today about, as Margie said, measurements of health literacy. So just to give you an idea of what we're going to talk about today, we're going to describe and define health literacy, look at the dual nature of health literacy measurements. So you can look at the readability of written materials as well as an individual's ability to comprehend and apply health information. We'll look at some tools. I know that's always popular in webinars. We'll give you some tools that you can try out at your leisure. We'll look at informal assessments of health literacy. And then finally, some evidence-based interventions, some things that you can do with materials to make the health information more accessible and actionable. At the conclusion of the webinar, our hope is that you will be able to differentiate between the two primary types of health literacy measurement, evaluate the strengths and ethical limitations of tools, and then finally describe specific health literacy interventions. And you'll notice that the slides are available. They put the link in the chat. So there are going to be some slides that are a little more text heavy that you can come back and refer to later on. But we wanted to make sure you had that material accessible. So, why are we here? We really have a passion for the opportunity for information professionals to advocate for easy to read materials as well as design and deliver information literacy instruction. But we do also think that librarians could benefit from practical evidence-based approaches to better connect with their communities to improve these interventions. And we do believe that it benefits from sharing multiple perspectives and viewpoints. So we bring our perspectives, and we're also looking forward to hearing your own expertise and experiences in the chat. As I mentioned at the beginning, there are Healthy People 2030 identified two aspects of health literacy, and you may have heard about this before. So there's the personal health literacy, and that's probably the one that most people think of right away, which is the degree to which individuals have the ability to find, understand, and use information services. And then there's the organizational health literacy. That's looking at the environment. So it's the degree to which organizations equitably enable individuals to find, understand, and use information and services. And you'll see health literacy work looks at both of these aspects, but probably where librarians can key in is looking at organizational health literacy. What can we do to advocate that our health systems are enabling individuals to do this? And also creating access and maybe even creating the materials themselves that people can use that help them understand and use that information effectively. And this ties really well to measurements of health literacy because there's really two different types of measurements of health literacy. There's the one that ties more to personal health literacy, and that's looking at measurements that look at an individual's comprehension, ability to understand, and ability to use written health information. So you can measure an individual's ability. Then you can also measure the readability of written materials, and that ties more directly to organizational health literacy. And we're going to talk about both of those types of measurements today. So again, thinking about how do we assess what a person can understand, and then also how do we assess what we're requiring that person to understand, so the materials they're interacting with. And I'm going to start with that second piece, the readability of the materials. So that's really the one that we've been looking at longer, 100 years now. We've had the first text readability formulas, and they grew out of the military, actually. So looking at military handbooks and how easy were they to understand. And then it's kind of grown in other areas as well. Then in the 1940s, you see Flesch is one of the researchers who really started arguing for the use of word count, sentences, and other things in written materials. These probably resonate with what you're familiar with as well. So how can we assess how easy is it to understand what I'm looking at? And oftentimes some of the first things that come to mind are those aspects. And then the second kind of level of that was in the 70s, looking at the number of sentences, syllables, so thinking about using shorter words, fewer sentences, getting to the most important elements. And then finally, in the 90s, looking at how is the page organized? What's the writing style? How does it appear? How does it appeal to a culture or a situation? So that kind of shows you how this has developed over time. I wanted to talk quickly about some of the features you can use to do this. So you may know that Word actually has this built in. If you haven't played around with it, after this is done, I definitely recommend checking it out because it's probably the one that we have the easiest access to. If you've got Microsoft Word, you've got this available to you. So you go over here where it says Editor, click on that. And that's where you can come in here. I actually pulled up the chapter that Julie and I wrote about this topic and went in to document stats here, and it shows you here. So it'll show you here, this is probably the more important part here. So looking at how can I simplify this, and then this will actually give me some readability scores that we're going to talk about in a minute. So you can see the grade level was a 22. Now maybe that was appropriate for a textbook like we were writing, but if we had wanted to share this information with the general community, we definitely would have worked at how can we lower that reading level. So again, this is a nice, easy way to look at your materials. It's already built in. Another resource is readabilityformulas.com. It's got some automatic checkers built in. It also has definitions of some of the most popular formulas and tests. I will caution you, as you can already see from this screenshot, it's got some ads in it that make it really hard to figure out where exactly do I go to use the tools instead of go to an ad. So I probably wouldn't recommend this to a patron. I might use it myself, but you're going to definitely have to use it with caveats. Whereas the Word, if you're working with public health practitioners or nurse educators, I would definitely show them where to go in Word. That's pretty easy to do. But this tool I might use with caution. But it is one of the nice ones that's out there for kind of figuring out the tests that are out there and doing some initial checking. I also was like, let me look and see what AI would do. So I just said, hey, do you have readability checkers built in? And yes, they do. Not a big surprise. However, I would have also highly suggest using this with caution, just as we do with all AI tools. We want to consider our environmental impact. And also, I don't know how rigorous they are, how accurate they are. But again, it could be an easy way to get started and kind of, if you've got a resource, put it in there and see and just get a quick snapshot of what's the reading level. And if it's telling you, it's at a 12th grade reading level, maybe you say, you know what? I'm gonna take a pause and figure out how I can adjust this. So again, I probably wouldn't use this as my go-to resource, but it can be a helpful starting place, as we always want to caution with AI. And it might also help us kind of simplify. So you can see, give me some ideas for simplifying it. I've done this occasionally, like let me figure out another way to write this where it would be clearer or more simplistic, and it can give you a starting place. Again, I don't want it to do the work for me, but it's out there. There actually has been research that's shown that computerized tools um, uh, do not work as well as somebody actually physically counting the words and things like that. That probably doesn't come as a surprise, but the research does back that up. This study is from 2018, so they were looking at software rather than AI. So I don't know of any tools out there that have used AI in a similar way, but I do want to caution that computerized assessments may not always be representative of the actual reading levels of patient education material. So again, it's a helpful tool, but it shouldn't be like what you rely on. It's helpful to take a look at and kind of give some guidance, but we always want to complement that with other things as well. Some other things to keep in mind. So, things I've talked about so far are more looking at the words, but we also want to think about print size and type style. So, like serif and sans serif fonts, looking at color contrast, concept density. If you're in an unfamiliar context, what community am I in? We're going to talk about these things again through the rest of this webinar too, but I just want to bring these up here now because they aren't always assessed with those standard readability formulas, and they should be taken into consideration. So those formulas that we're talking about are just one piece of the puzzle. There are other things to keep in mind when thinking about the readability or the health literacy levels of materials. So I've talked quickly about content. Now I'm going to move into the person. So again, like we talked about, you can look more at the organizational health literacy and measuring health literacy materials. And now we can also look at the person. So what is personal health literacy? What are those literacy levels like? So a history of those literacy assessments. And as you can see from the years, that's more recent that we've actually been looking at how can we measure an individual's health literacy skills or levels. So in 1991, we had the first tool to measure health literacy specifically. And at this point, there are more than 50 instruments in the published literature. And they approach it from many different ways. So there's lots of thoughts about what's the best way to get a snapshot of someone's health literacy skills. As you can tell, if there's 50 instruments, they're kind of all going about it in different ways. And also, several of the measurements have additional versions. So, it's 50 plus, obviously. So there might be an English version and a Spanish version. There might be the full version and the short version. So that's some things to keep in mind. Either if you're thinking about using the tools yourself, or you're assessing literature and you want to see, okay, they're claiming that their population has, a seventh grade reading level. What tool did they use? And you can kind of look which version did they use? Was it shortened? All of that. So if you're looking at assessing and measuring health literacy, there's this review that you'll see in our references list that's really helpful for kind of comparing across some of the key literacy assessments that are out there. So some of the more popular ones are, you might have heard of Realm, which is looking at word recognition. Like I've seen that word before. TOEFL is actually more measuring comprehension of a term as well as numeracy. And that's another key piece of health literacy. So not only understanding the health words and the health concepts, but also putting the numeracy into practice. If I'm taking a pill 3 times a day, is that different than every 8 hours? So the numeracy piece. And then there's also newest vital signs, NVS, which is also looking at literacy and numeracy. And these are performance-based tools. So they are looking at patients to perform a task. That's one type of assessment. We're going to talk about different ways to do that, but one of the ways you can assess an individual's health literacy levels is to ask them to do something. And these are some of the most popular ones you might have seen out there. This next slide has a lot on it. If you want to take a screenshot now and save it, you're welcome to. Again, we have the slides available for you, and we've also created a two-sided handout that Margie has available with this webinar's materials that has this table too. So don't panic. I'm not going to read through the whole thing because, again, you'll have access to it later. But it's just an example. Here are some of the some of the five more common assessments you might see in the literature or that you might choose to use yourself, and just kind of looking at what are the different ways they go about assessing individuals' literacy levels. So again, the TOEFL is asking people to do specific tasks, and you have to comprehend certain words, do a numerical ability test. The newest vital signs is looking at a nutrition label. So again, that's measuring something really key, but if you're, if it's another aspect of health information, maybe it's not assessing, at the same level. So, we're looking at different things. Realm, again, is looking at a patient's ability to read medical terms. So it's administered orally. They hold up the word and then the person has to pronounce it. And that's how they assess whether their literacy level. So obviously there's limitations with how well can someone pronounce something and does that mean they actually understand it? And then as I mentioned, there are other language versions available. So we have the Spanish test I've got up here. It's based on the realm, the one that's just above there, where the terms were translated into Spanish. And then finally at the bottom, again, there's another test that looks at pronunciation. And it also is designed with three common excuses in mind to help patients feel less intimidated. And Julie's going to talk a little bit about that too, in terms of assessing and what kind of, power that might come into play when thinking about that. So now I'm going to hand it over to Julie to talk a little bit more.
Okay, good morning, everyone. There are two popular health literacy assessments. These handle literacy assessments a little bit different, but they are relying on the patient's perceptions of their own ability and their comfort doing tasks. So the brief, which is the brief information seeking is measures the information seeking and document literacy, whereas the SILS is application and comprehension. Next slide. Okay, the brief health literacy tool. This has actually had a few different generations. It started off with 16 questions, but the most populars are currently either three to five questions. These are the questions that the brief tool asks. It asks, how often do you need help reading hospital materials? How confident are you in filling out medical forms? How often do you have problems learning about your medical condition because you have difficulty with written information? And also, how often do you have problem understanding what is told to you about your condition? The single item literacy screener came out of the brief health literacy tool. When they validated it and did their statistical compilations, they determined that one of those questions was more highly correlated with people who had low health literacy. And that is, how confident are you in filling out medical forms by yourself? And that's the kind of question that could be slipped into a conversation if you didn't want to do any kind of a formal screening for it. Okay, next question. Okay, so we've got a poll question here. Just a quick idea. Is it a good idea to administer formal literacy assessments in clinical situations? Okay, so yes, no and maybe are pretty much evenly uh, out in there. So let's see, go ahead and switch to the next slide, please. Okay, so formal literacy screenings in clinical situation. I saw some people in the chat that have kind of hit on the two main issues with that. It could allow a health professional to tailor their communication needs directly to the patient and to make sure they address what the patient needs. However, it can make a patient incredibly nervous. There is always an amount of shame and stress if you talk about doing a literacy assessment in a clinical situation. I know I would be incredibly nervous if someone asked me to take a test to see how well I read while I was sitting there in a doctor's office. It would be very uncomfortable. Current evidence says that it is not the best idea to use a formal literacy assessment in clinical practice. Instead, it's recommended to use the Universal Precautions, which is a document that has been done by the Agency of Healthcare Research and Quality. And I'm going to include a link in there as to how to get to that. What that does is it recommends that everyone assume that a patient will have some trouble with reading or comprehending the medical information or health information that they are given, and to focus on your communication style, keeping that in mind. Okay. Next slide. Okay. But there are some informal health literacy assessments that can be done. It's mainly keeping in mind two things: observing a patient's behavior and asking questions. Okay. Next slide. Observing patient behavior, a patient or a patron who has a low health literacy tends to miss appointments or have a lack of follow-up of health situations. So if you keep that in mind, is the patient missing a lot of appointments, or are they not following up the way that we requested them to follow up? Also, a big sign that a patient or patron could be having trouble with health literacy or even literacy in general is in incomplete or inaccurate registration forms or medical history. If you ever see a medical history form that is filled out and everything goes down all the way from the first question to the last question are all no's or all yeses, that is a big sign that they are not not actually reading the questions and understanding what they're asking. Another thing that can be a sign of low health literacy is an avoidance of reading. And this can come up in some sneaky ways. The person that you're working with will not always say, I'm not going to read this. It might be, I forgot my glasses. Can you just read this for me? I'll take this and read it when I get home. I'm not going to deal with it right now. Or I'm just too tired to read right now. Could you read it? Or sometimes an impatience or hostility towards written materials. Sometimes people will just look at a written material and put it aside and saying, I'm not going to look at this. Just tell me what I need to know. I don't want to read it. Patients who have low health literacy generally ask fewer questions during a clinical encounter, and they also tend to make more medication errors. And this could be just mistaking one medication for another, or it could be even the scenario that is described in the book Health Literacy: Prescription to End Confusion, where a parent actually took their child into an emergency department to get medication for an earache, and the child was prescribed liquid antibiotics. So the parent actually put the antibiotics in the child's ear because they didn't understand that the liquid antibiotic was supposed to be taken orally. And it makes sense that the medication is for an ear infection, so I'm going to put the medication where the infection is. Next slide. Also, one of the big signs is identification of medication by looking at the pills instead of looking at the bottle. The name may not be anything that means anything to the patient. They could be looking at the actual pills and say, okay, this little white round pill is my blood pressure pill. And that can cause a real problem when things go generic and different manufacturers will have different looking pills. Another thing that you can do to identify whether or not a patient is actually reading is look at their eyes when they look at the page. You can generally see if someone is reading. They will look at things in groups, and you can follow that they are reading in a sequential order or a somewhat sequential order. If their eyes wander all over, they're not reading it. Or also sometimes people will use their finger to help them read, to go underneath words and help them follow through. Okay. Next slide. Also asking questions. One of the big questions you can ask is ask a patient to, if you have a prescription bottle, have them look at the prescription bottle and explain how they will take the medication. This could be done on an over-the-counter medication or an actual prescription. You can ask how a patient wants to learn. That is, I don't know if I would phrase it that way, but what you want is to see, what do they prefer? Do they want something written? Do they want to talk about it? Do they want you to send them a link to a high quality YouTube video and have them explain it? So there are lots of different ways people prefer to learn, and sometimes just asking that can help, as to whether or not a written tool will help them. You can consider asking the question from the single item literacy tool. How confident are you in filling out these forms? Also, there's another technique. This is a good way to gauge whether or not you were able to get your point across to your patron or your patient. The teach back technique, there's some great videos on how to do it. And it's basically asking the patient or patron to explain what you already explained so that you know if you did a good job teaching. So show me how you will use your asthma inhaler so I know that I explained it to you well. Or I know that someone is going to ask you when you get home, what happened at today's appointment? What are you going to tell them? And asking them that will give you an idea as to whether or not you actually taught the patient well enough. Okay, next slide.
So now we're going to turn to some health literacy interventions, and you'll notice that these interventions really focus on that organizational health literacy piece. So if you attend health literacy conferences, you'll notice that the conversation really centers around how do we make our environments easier for people to function in, easier to access information, use the information, understand it, and less on let's kind of fix the literacy levels for a myriad of reasons. People are not broken. We need to meet them where they're at. And so, while librarians can do some of the things focused on personal health literacy, like teaching people to assess for accuracy of information and bias, and all of that is really important. It is also important that we advocate for easy to use materials and the importance of nurse educators, health educators, all of that. So these interventions, again, are really going to focus on the organizational health literacy piece. So this chart, again, the slides are available. This one is also on that handout. So I'm not going to read through every single thing, but it gives you some ideas about what are some of the ways that we can design the materials or modify materials to help make it easier for people to understand. So we can present only essential information. And sorry, I just noticed that first row is copied twice. We can only present essential information or put that key information first, like what is the least that you need to know, the most important things. There's a lot of discussion about pictorial representation. So either adding symbols, using icons to help distinguish between things. That is extremely important, especially if we're working with multilingual populations. Those pictures can really be a key. We can also think about alternative media, like Julie was talking about, videos, other ways to learn information besides reading text. Thinking about other ways to look at the design of the document, like a chart, larger font sizes, white space, and then also figuring out ways to notify physicians of patient literacy status. So, are there ways that the electronic health record might be able to make this clear, or nurses might be able to communicate this? How do we do this in a respectful and useful and actionable way?
Some of the other things you can think of for organizational health literacy when presenting a patient with actual written information. Numerical simplification. Quite a few people will just completely, check out when you're asking them to do the math. So do the math for them. Contextualize a if it is, let's say, a fraction, using consistent denominators so that you can see the differences between them. Visuals are key. Patients will very often rely on visuals for their information. So if you can supplement text with pictures, it is always best. Specifying time frames, sometimes having someone say every 6 hours versus 4 times a day. There have been many times when people have said, I wasn't sure what they meant by 4 times a day, so I just took everything at one time. So if you say every 6 hours, or with breakfast, lunch, dinner, and before bed. Okay, next slide. If you are providing actual written documents, try to use plain language and plain formats. If you use one of those readability checkers, it's generally recommended that things be in between like 6th and 8th grade reading level. You can go up or down on either way, depending on the situation. Have a lot of white space. If you hand someone a piece of paper that is full of text, it's very intimidating. So try to have white space and open, and open and inviting look to it. Again, visuals, fonts. If something is displayed on a screen, it's recommended that it be a sans serif font, a more plain font like the ones that these slides are. But generally, paper documents are better done with serif fonts. Also, actionability, as Emily mentioned earlier, you want to focus on what you need to know, not what is nice to know, and what can someone do, and make it something that they can take and do something right then, rather than just background information. Next slide. Also, if you are working with actual printed health information, test it. If you are writing your information, or even if it's something that you get from someone else, test it with an audience. Oftentimes, and I can speak from personal experience with this, oftentimes you can create something that you think is just perfect and it addresses everything you want to say, but then when you get it to your audience, it just totally misses the mark and it is not what the audience needs. And I'm going to show you some examples here. This is a website that we developed. I worked with a pediatric dentist, Dr. Priyanka Ritwick, who is now at the University of Texas. We were talking about kids that come into a pediatric dental clinic and they have medical needs. They have medical conditions that they are dealing with on a daily basis, and they aren't aware of how this can affect their oral health. So we thought we would go ahead and create something that we could gear towards parents or caregivers that can explain this. So we created this site. It was funded by the NNLM, and it's actually a little old right now. It's from 2019, 2020, I believe. So it is a little old, and it has kind of been put to the side because we did run into some roadblocks that we couldn't get through. But it was different topics, and I just chose this topic, children with autism spectrum disorder, and these are just information that the parent might need. This is what you would see on the screen. So we used a simple font without serifs, and it is what you can do. Tell the dentist about your child's strength so that they can use that to build on to help provide patient care. It also has things like questions that you should ask. They're very actionable things. If you notice on here, there are no visuals. That was one of our biggest issues. They're very text heavy, and we weren't able to create visuals for them. If anyone knows where you can find good dental visuals, please let me know. Shoot me an email. I would love to try to revive this project. Okay, next one. This is the same information, but it is a PDF. So it is a design to print. And so the text is different, but it still has the same information. So you're allowing the parent to look either online, read it online, or take it with them, print it and take it with them. Okay, next slide. Okay, so a few resources and tools. I am hoping that some of these will will answer some of the questions I've been seeing in the chat box. Okay, next slide. I wanted to cover five resources and tools that can help you. Health literacy tools toolshed is, let's see, it's a fantastic tool. And this is relatively new. It is done by Tufts Medicine, and this will allow you to find a measure. You can search by name, you can search by author, or you can filter it. There are significantly more filters further down on the page, but this is just a screenshot of the page. And it is wonderful. It will tell you, it will give you links to validation studies. It will give you a link to the author um, if you want to contact the author to see about using it. It will give you, the evidence that backs up this measure. Okay, next slide. The Center for Healthcare Care Strategies is a great website that gives you a fact sheet. You can download the whole packet or you can download one or two, and it can give you information about assessing literacy, about doing readability checks. It can give you information on tips on interacting with patients. The Center for Disease Control has a large health literacy section. What I like about this is the action plans and the research summaries. Go ahead and explore that. That gives you some great resources. And then finally, AHRQ, Agency for Healthcare Research and Quality. These are the people that publish the Health Literacy Universal Precautions Toolkit. And as I said before, I'd highly recommend you download that and take a look at it. They give you quite a bit of professional education, training, and links to publication that deals with health literacy. Also, they have a section that can help you find funding if you have a project that you want to work on. And then finally, a favorite of health sciences librarians everywhere, Medline Plus. Medline Plus is a fantastic resource. They have quite a bit of health literacy information in there. It will talk you through creating your own documents and and what you would need to implement health literacy initiatives. Also, if you don't want to write out your own health information at an easy to read level, they do have quite a bit of easy to read health information that is written at probably between a 4th to 8th grade level, depending on the information. So these are our references. Because we're librarians, we have to have lots of references. And also, I want to plug the book. Emily and Deborah did an amazing job on that book. I just did a little part of it. I would definitely recommend you take a look at that.
Thank you, Julie. Yeah, this we're chapter 3 that's specifically about measurements. So we were grateful for the invitation to talk about measurements, and there's chapters on other topics, obviously all regarding health literacy in the book. And I'm seeing great comments in the chat and also questions. I did want to note, yes, there was a comment earlier about neurodivergent individuals might have false positives for low literacy if you expect them to read a document immediately and demonstrate comprehension. Yes, excellent point. Yes, these tools aren't going to work equally with all individuals. That's one really salient example. I also think we have to just think about the power imbalance between a healthcare provider and a patient who comes in. Gender can play a role, age can play a role, and so we have to keep all of that in mind when making generalizations about how someone performs on an assessment. And so that might be why it's helpful to know like maybe some tools work better with some communities than others. And so maybe if we're asking someone to perform a task really quickly, that's not going to work as well with neurodivergent individuals if that's a community that we're targeting or working with closely. Um,
Okay, yeah. So, yeah, there are three questions in the Q&A, and then there's a couple that are kind of out there in the chat, which are a little bit hard to track, but we'll do our best. So, let's see. So, do you want me to just read them to you, or do you?
yeah, why don't you read them,
Okay,
Margie? That
yeah.
would be great.
Okay, yeah. So, the first question uh, says research shows that environmental health literacy is a separate measure from traditional personal health literacy. Strong traditional health literacy also does not translate to strong environmental health literacy. Do you know of any research on effective environmental health literacy tools?
Yes to all of that. I will say that that's why we were kind of focusing on those measurements that we're looking more at the materials that people are interacting with, because that's going to look at the, like, I guess the textual environment. In terms of research, I don't know, Julie, if you have thoughts on research that looks at it beyond like the materials that someone's working with in the environment.
I don't.
Yeah.
I don't know.
Um, But it does make me think that it's totally true that one may not necessarily line up with another for those reasons we were just talking about. Like some communities may have higher levels of literacy, and then you put them in a situation that's uncomfortable, that doesn't match their learning styles, their cultural preferences, all of that. Yeah. I kind of as a fun anecdote, my dissertation was on health insurance literacy, and the higher education level that you had, the lower your ability to understand health insurance information was. So I think it's totally true that it's going to really depend on what kind of health information we're talking about, where we're finding ourselves, if we're in a in a community where we're part of the minority or part of the majority. It's all going to play a piece. Um, but I don't know. Feel free if others in the chat know, please feel free to put additional research that comes to mind.
Okay, the next question is what recommendations have been made to establish, oops, guardrails for AI health information?
That is outside of my
Okay, so
um
none. Okay.
my my expertise. I know
Yeah.
I know there are places that are working on those AI
Mhm.
guardrails. I have not myself seen them applied, or I haven't seen health materials be the focus on anything I've seen. But please, if people know, I would love to know.
Oh,
Uh,
heck.
Julie,
Bailey, do
were
you?
you gonna?
Oh, I was going to say, Bailey, do you have something you'd like to add for that question?
Oh, are you saying in the Q&A? Because,
Yes.
oh no, I was just marking it that it was being answered live by y'all, but thank you.
Oh, okay. I'm sorry.
No worries, no worries.
Yeah, so that's a stay tuned because I know AI
Mhm.
is evolving every day, every hour. So yeah, we'll stand by and hope that that happens.
Right?
Okay, so next question is, has anyone published instruments for health insurance literacy?
Yes, there is one. It's called the HILM, Health Insurance Literacy Measurement. It is a self-efficacy tool, so it's how well do I think I understand XYZ? And again, I think there's limitations to that, but that is the tool that's out there. It has two different pieces. So that's what I've used in the past. That's like the most common one. I think some tools have some aspects kind of embedded in them, but that's the one that's only for health insurance literacy.
Right, thank you so much.
Hmm.
All right, and then the next question is there a good way to assess the literacy level of visual materials or how well a person understands a visual? This person does research with graphic medicine, but her measures are currently, or their measures are currently kind of simple.
I saw that question. That's such a good question. I don't know. Julie, do you know?
I don't know.
Yeah, I know generally visuals are more accessible for people, but you're right, that doesn't mean all visuals are created equal. So I'm wondering if we went to that let me pull up that slide again, that health literacy tool shed that Julie was talking about. I might go in there and say we're find a measure and just put in visual or related keywords and see if there's something in there. That's probably what I'll do after this webinar is over because I'm curious as well.
Yes, yes.
All right. So, next question. What type of health literacy trainings are available for medical interpreters, if you know of any?
Oh my
Oh,
gosh.
that's a good one. I do not know.
Don't know
Okay.
that.
All
Mm-mm.
right. Well, we'll have to keep looking out there then. All
Right?
right. And then, do you think some of those literacy indicators would still apply today with the severe deficit in our attention spans? And how do you adjust for the shortened attention spans of today's incoming population?
Oh,
Yeah.
yeah. I think the best thing for that would be to just limit the amount of information and focus on actionable, the few things that you absolutely need to know and what can you do to make it actionable.
And I'm think several of these last questions have also made me think about the importance of testing materials. So that would go for visual if you're working with medical interpreters. If you're thinking about, younger population, if that's what the kind of the inference is here. Testing the materials, making sure that they work, kind of getting a sense like when did your attention start waning during this thing when you were reading? I'm also thinking about videos being very maybe a good resource, but we've got to use those with like extreme caution. I've seen some interesting research on financial literacy videos directed at young people. But the problem is that they easily can veer off into like kind of having an ulterior motive, like our how So we
Mm,
want to make sure if we're developing materials that we're not selling anything and all of that. And
okay.
with some video platforms, once they've watched your video, they're going to spin out into somebody else's video. So how are we kind of keeping it centralized? And there's a lot of difficulties around that, but that's what's coming to my mind at the moment.
Okay. We have one last question, and I found it in the chat. Are there any measurements beyond the individual level? So, for instance, like subpopulations, race, ethnicity, community, zip code, and beyond?
The only thing that's coming to my mind is, the research that looks at general statistics. I don't know how you do an assessment like on a population, but you can look generally at what does the research show, the demographics and trends for different demographics. And as we know with health disparities, there's a lot of um, oh my gosh, I'm totally blanking on the word. But it's not just one thing. With health disparities, you might be part of several populations that might be inversely impacted by health outcomes. So I don't know of any tools that look at populations. Do you, Julie?
I don't.
Yeah.
They
I don't even know how
just,
that would work exactly, but
Yeah.
mhm.
Yeah. It might be tough.
but definitely trends. I know there's the fast. If you've ever heard of fast stats, it's from the CDC. That's a good place to go if you're looking for general health statistics for different communities. So that's what's coming to my mind.
Okay. And then one real quick one, and then we have to move on to keep everyone on schedule here. I recall the WebMD effect, where people were using the website when it first came out to self-diagnose. What might be some ways to respect but correct when someone has done research online but has lacking or false medical information?
That's the million-dollar question. I also want
Yes.
to put a caveat that I think it's important that people are empowered to do research ahead of time. After, I shouldn't even say research because that's not even what they're doing. They should be
Mhm.
gathering information ahead of time and after an appointment. I don't think we want to squash that, but I do agree that sometimes that leads to making decisions that are against the advice of the healthcare community. And so that is $1 million question. I don't know that we can answer that in 1 minute.
Yeah,
Right.
because there is research out there saying that people are using ChatGPT to
Hmm.
diagnose
Yes.
regularly,
Yeah.
and it tends to do an okay job. There are often major issues to it, but it tends to do okay. It They have found that sometimes ChatGPT can create medical information that works better for people who are neurodivergent. So it's, you know, oh, it it's so there is the hard part is that there's so much good out there combined with the less than good.
Okay.
And I did know, I wanted to follow up on one thing. If you're interested in learning more about this, somebody mentioned that there's an association dedicated to health literacy. Yes, the Health Literacy Association, there's a annual health literacy conference usually in May. Since the pandemic, it's been online and free or very low cost. I've attended many years, so I would highly recommend checking that out. I'm sure these topics will be discussed in the conference. So if you're interested in like continuing to follow this conversation, that might be something to check out.
All right. Well, thank you all so much. First of all, to our speakers, Dr. Vardell and Dr. Schiavo, for sharing your expertise, and to our audience as well. And we look forward to seeing everyone next month for Health Bites with Region 3.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.